With Australia officially in the winter, how does the cold weather affect your body? Well, stay tuned because in this episode of Dr. Nora, I take you through 5 ways the cold temperatures can affect your body and how to prevent them. Firstly, let's talk about our skin. Now, for those of you out there who have noticed that your skin gets a little bit cracked, a little bit itchy, a little bit flaky, more dry in the cold weather, well, this simply isn't a myth and you are not alone. This is because of a number of reasons that happen during the cooler climates. For example, the temperatures drop down, the humidity also drops as well. And this in combination with one another actually degrades our skin barrier. And so we appear to be a lot more flaky, a bit more dry as well. But not only that, but when we change from temperatures, for example, going from a warm, nice environment in your home to a cooler climate outside, it also affects the skin barrier too. And so we know some people who've got skin conditions, for example, such as eczema, may have an increased amount of symptoms during the colder months. And this may lead to things like more flaking, more itching of the skin, and even cracking of the skin as well. And it's imperative for people who do suffer with eczema to try to maintain their skin hydration as much as possible. And so a few things you guys can do out there, if this does apply to you, is when you're rugged up in your home and you're about to go outside, try not to make your home too warm or too hot, because the extreme changes of temperature can really affect your skin because it has to acclimatise a bit better to the changes in temperature. So rather instead, keep your house nice and warm, not necessarily boiling hot, but nice and warm so that when you are going out into a colder temperature, it doesn't have to do so much of a dramatic acclimatisation. We also see people who've got a condition known as seborrheic dermatitis, which is a condition which is almost like dandruff, only a lot more severe, where they may have flaking of the skin around their hairlines, in between their eyebrows, on the nose and under the eyes, for example. Their condition also gets worse in the winter time as well. And again, it's because of the cooler temperatures, the decrease in the humidity, and also the extremes of changes in temperatures. Now, whilst it may be really tempting to jump into the shower and have a boiling hot shower, this is certainly not recommended for those of you who do suffer from seborrheic dermatitis. Instead, again, it's about keeping the temperature nice and neutral so that your body doesn't have to acclimatise to the changes in temperatures. So instead of having a boiling hot shower, as tempting as it may be, have a lukewarm shower. And also don't overly dry your skin, and we'll talk about that in a second, but don't overly dry your skin as well, and moisturise. You may also wish to add a humidifier in your house as well, because like we said before, the drop in the humidity can affect your skin barrier. Now, speaking of moisturisation, that is something that I literally will tell my patients day in, day out if they do suffer from any skin conditions such as eczema or even dry skin. Moisturisation is super, super, super important, especially in the colder climates. Now, this doesn't have to be anything fancy, and it doesn't have to be one of those big name brands, but something that essentially has got very little scent to it, so little perfume or very little fragrance to it, because sometimes when they add too much fragrances to a moisturiser, it can make it very irritating to your skin. Now, for me personally, I like to moisturise my skin, especially in the cooler climates, probably 2 or 3 times a day, because it helps to counteract all of that hand washing that we do as medical practitioners, all of the alcohol gel that we have to use, because our skin naturally gets dry anyway from this on a good day, but when you add in those cold climates, it does get a lot worse. Another trick that I like to do, and this may not necessarily apply to yourself, and you can test this yourself using a patch test on your skin to see if it's suitable for you, is after I've had a shower or a bath, which is not going to be a boiling hot one, because remember what we said about the skin, guys, after I dry myself, and this isn't like a vigorous scrubbing, but you want to keep a little bit of water, I then apply a little bit of coconut oil onto my skin. Now, what this does, it actually helps to trap in the water that could be on my skin, and helps to keep the skin nice and hydrated and moisturized. Now, as I said before, this may not necessarily work for you, but it could be something that you may want to try, because coconut oil is not a replacement for your moisturizer. This is really just an addition to, but it does help to keep your skin really hydrated. Now, for me personally, what I like to use or look for when I'm getting my coconut oil is to look for something that has got a food grade stamp to it. Now, this will be something that's unrefined, it could be organic, say, and there's no bleaching to it, there's no nasties in it, because you just purely want the coconut oil. And when you place it onto your skin, will help to trap in that moisture and keep your skin nice and hydrated. Now, a few tips just with the coconut oil: avoid any kind of acne prone areas, for example the face or the back, because yes, it can be good for moisturization, but because it helps to kind of block the pores and keep the moisture into your skin, it can also lead to outbreaks of the skin. For example, in people who've got acne of their face or even of their back, definitely wouldn't recommend coconut oil in those areas. But for the arms, for the legs, for the back of the elbows, for example, areas that could be really dry, this could be something to try for yourselves, and it's fairly cheap and easily accessible in the supermarkets. So we know that the cold weather can affect our skin and make it really dry, but what other impacts of the cold weather does it have on our body? Well, secondly, it can cause a lot of joint aches and pains. Now, we don't necessarily know why this happens, but there are a few theories out there. For example, the first of which is that when the temperature is colder, the pressure also drops as well. And so what happens to that, and what we think happens, is that the muscles and the tendons which attach to our joints actually contract and expand. It's that movement of contraction and expanding that can cause pain and joint aches to the joints that could be affected by arthritis. Similarly, we also know that the colder temperatures may also thicken the fluid within our joints as well, making them feel a lot stiffer when you're getting up in the morning, when you're trying to walk. And you may notice that as the day goes on, or if your joint gets a little bit warmer, you're a bit more freer and able to walk. We can certainly see these patterns happening in people who have got, say, arthritis or osteoarthritis. We tend to be a bit more affected with the cold weather. So here are a few tips for you guys if you are affected by the cold weather. Really wrap up warm. Make sure that you're covering up those achy joints. Make sure that you're kind of wearing lots of nice warm stockings or nice trousers to keep you nice and warm. You may also use or benefit from using some heat packs around the joints as well. One exercise that is really good for you guys out there who have got joint aches is to jump into a swimming pool with some warm water. Now, of course, make sure you check this with your medical doctor, but we know that warm water around the joints is a nice natural anti-inflammatory, and so it helps to alleviate those muscle stiffness, those aches and those pains. And if you're really struggling despite all of these measures, it's probably worthwhile speaking to your medical doctor, because they may give you some anti-inflammatory medications to use, whether it's oral or whether it's a topical gel that you can use and apply as well. And aside from trying all of those things, make sure you do not strain your joints or your muscles. So if you've got some heavy lifting to do, maybe you can ask somebody else to do it for you. Give those joints a break. The third impact of the cold weather on our bodies is that we get an increased amount of us picking up viruses such as the flu virus or even the common cold. But why is this? What causes us to catch more colds and flus in the winter season? Well, we certainly know that the viruses, when we have cold weather, they tend to stick around the air for much longer, and they tend to be more stable as well, making us more susceptible to catching those colds and bugs. Now, of course, there are people out there who are also affected by these more so than others. For example, those people who may be immunocompromised, they may have another secondary illness that makes them more susceptible to catching these infections. But not only does the cold weather make us more susceptible to catching bugs, it can also affect those people who've got respiratory conditions, such as asthmatics, for example. Asthmatics tend to have a problem or difficulty breathing in the colder climates. And we know that asthmatics already have sensitive airways. When they have cold air coming towards them, it actually makes the muscles contract around their airways, making it a lot harder for them to breathe. And so we have to be particularly careful with our asthmatics during the colder temperatures, because they may have more difficulty breathing than in the other times of the year. And so if you're an asthmatic who is having difficulty breathing, my best advice for you is obviously to go and speak to your doctor, but certainly to take your preventer inhaler to make sure that you're keeping yourself nice and healthy, keeping those airways nice and patent during the winter seasons. And of course, if you are suffering from colds and coughs and flu-like illnesses during the winter season, well, my best advice to you guys out there is to make sure that your immune system is nice and strong. Now, I've got a bunch of videos on my channel about that, and I will link them down in the description below. But broadly speaking, making sure that you're having a really healthy, balanced diet, which consists of nice fruits and vegetables, making sure you're sleeping at least 8 hours a day, making sure that you're doing some exercise, at least 30 minutes, 5 times a week if your doctor allows for it, and also keeping yourself feeling nice and positive and happy, because all of these things help to build you up with a really good, strong immune system. And speaking of feeling happy, we go on to tip number 4, which is the cold weather can also have an impact on our mental health. We know that certainly not necessarily in Australia, but for countries who've got a much shorter day, for example, those people who live in the Northern Hemisphere, they have a really short day. And so what can happen is that people can get a condition called seasonal affective disorder, which is where they're feeling really sad and maybe lazy and unmotivated during the winter months. And the reason for this is because our body actually reacts quite nicely to the amount of sunlight we get from our day to day. And so when you have a shorter day, there's less sunlight for you to have, and so that impacts your internal body clock. And the result of this, or the net impact of this, is it actually decreases the amount of serotonin in your brain, which is your happy hormone. And so that explains why that some people, when they do have shorter days, they may get this seasonal affective disorder, which is where they feel really unmotivated. They've got no energy to do anything. They just sort of want to sit around at home. Of course, the management should be treated as a condition. And so what we tend to recommend is, if you do think you're suffering from seasonal affective disorder, make sure you keep your body clock in shape. Don't have naps during the daytime, and try to sleep every day around the same time, which will help to keep your internal body clock nice and regulated. Also, try to get out there and do some exercise. Now, this could be just pushing yourself to go to the gym maybe, or even going for a walk and taking a few minutes out of your day just to breathe some nice fresh air and getting as much sunlight as you can, provided it's safe with your UV. Now, if you don't think you've got seasonal affective disorder and you're generally just feeling sluggish and lazy on those colder climate days, well, you're not alone, because a lot of people also experience these symptoms. And just like if you were having a seasonal affective disorder, the best management for this is really to get yourself out there and to go out for walks, for jogs, maybe catch up with some friends and go for a nice tea or a coffee, but do something to keep yourself engaged and motivated in life. My final tip for you guys out there is to think about carbon monoxide poisoning. Carbon monoxide is an odorless gas that's released from fuel combustion heaters, for example. And this can have a really detrimental impact on your health. If, for example, your heater hasn't been serviced for some time, what could be happening is that you may be inadvertently releasing carbon monoxide. Now, the net impact of carbon monoxide, well, unfortunately, because it's odorless and you don't know that's happening, it can lead to carbon monoxide poisoning, which can then lead on to death. Now, this is very serious, and if you guys are using gas heaters to warm up your place, make sure you follow these really important reminders. Make sure that you're servicing your gas heater really regularly. Check for carbon monoxide, maybe through a detector. Make sure that your heater is compliant against the Australian regulations, or if you're worldwide, against your country's regulations. Make sure that you've got ventilation in your room, so keep a window open if you are using a gas heater to make sure there's fresh air constantly going in. And certainly don't leave your gas heater on overnight without any ventilation, because that can lead to an increase of carbon monoxide. But most importantly, if you're in doubt, then please make sure you check for your gas heater and make sure that it isn't releasing any carbon monoxide. And of course, there are lots of professionals out there that can do monitoring for you. Okay guys, so we've spoken about how the cold weather affects your skin, your joints, your respiratory system, maybe your mental health, and also how it can lead on to carbon monoxide poisoning. I hope you guys have found this video useful, and of course, if you have any questions or comments, please don't hesitate to drop me a line in the comment section below. But for now, take care and stay healthy.